with Dr. Luke and I today. Again, my name is Michael King with ClearSight. It's an absolute honor to be able to spend some time with you here and kind of just help you to discover the magic, if you will, of laser vision correction. And so our job here today is we're really here to serve you. We're here to provide you with all the answers to all of your questions about laser vision correction. So one of the first things I wanted to do is just to extend that invitation to you. My favorite part about doing a webinar with a prospective patient is to answer their actual questions that they have. So if there is a specific question or a comment or something that you've always wondered about laser vision correction and that's maybe held you back, I'd really like to encourage you to kind of to put that into the chat or the question, if you will, and Dr. Luke and I will be handling all of those questions for you. And so with respect to timing, I think you can find that the actual timing of the webinar, we'd like to keep it to around 30 minutes. Of course, if there's additional questions, we're more than happy to answer any and all questions. But again, Dr. Luke and I, we're really passionate about what we do, and we're honored that again that you spend some time with us here today. With no further ado, Dr. Luke, before we kind of get going, I wanted to introduce you and hear if you'd like to say any kind words to the attendees that we have.
Yeah, thank you for the introduction, Michael. I'm excited to be here, and we love what we do here at ClearSight, and I want to thank everybody for joining the webinar.
Excellent. So to kind of jump into it right away, these are I would say the top 4 reasons why somebody considers laser vision correction, and you may find yourself falling into one of these 4, or maybe it's something a little bit different. But the first one is just the obvious, which is being able to get that freedom from having to wear glasses and contact lenses. And if you think about it, what glasses and contacts are is an artificial surface that's kind of sitting on your face that's helping you to see better. And just over a period of for a lot of people it's years, they really find this just is not doing it for me. And if you've known a friend or a family member who's had LASIK, that typically, and seeing obviously that they've had a great result is a great kind of just a little spurring you on to be able to decide that this is something that you want to consider. And so getting that freedom is I would say one of the largest reasons why people consider laser vision correction. The second one is lifestyle improvement. If you're highly active and for example, we have people all the time where they want to be able to see that golf shot. Now, we can't improve your golf game, but we can definitely help you to be able to see better. Or maybe at just with your work, we've done everybody from pilots to stay-at-home moms to people who just frankly want to be able to not have to wake up and see that alarm clock to kind of grab their glasses. And so whatever the reason is for you, that's what we really want to kind of tap into today. And so and then the other thing is just the time savings. We all have one life, and really we have a limited amount of time in which to live it. And spending time fiddling with glasses and contact lenses and getting new prescriptions and all that stuff, it adds up. It's just another reason why people consider laser vision correction. And one of the biggest ones I find is the cost savings. And if you look at it, and we'll go a little bit deeper, and we'll talk about the cost of LASIK comparative to glasses and contact lenses. But over your lifetime, you absolutely will find that you definitely save a sizable amount of money by having laser vision correction. And so with respect to the cost savings, I do want to let everybody know that by coming here to the webinar, again, thank you so much. You will get an email shortly after this with a $1,000 gift certificate to use that laser vision correction at our practice. So I encourage you to take advantage of that. And then one more thing before I really get moving on here is, the outcome for you today is not to make the decision to have LASIK. The outcome here is to get all your questions answered and then to make one decision. Would you like to find out if you are a candidate for this procedure? And so we take a very relaxed, transparent approach and with our patients, a consultative approach, if you will. And we'd like to invite you in to come visit us and just to see if LASIK is right for you by coming in for a complimentary evaluation. And that's where our doctors and staff will get that opportunity to really find out and take that fingerprint, if you will, of your eye and see exactly what's going on and provide you with the most appropriate solution to help you out with your vision. So with that being said, LASIK absolutely can give you give you freedom in your life. And so here's some patients, some happy patients of ours I do encourage you, as I will always encourage our patients, that if you are considering laser vision correction, feel free to check us out on, it's Facebook or Google, and just kind of see what our patients are saying about us. And I think you'll find that the experience that they get, people are pretty happy with us here at ClearSight. So here's the question for you: is why are you considering laser vision correction? What got you to this point right here? What's causing you to think about whether or not this is something that's right for you? And so what we find, for a lot of patients is, maybe it's just the idea that just the inconvenience of wearing the glasses, and if it's they can smudge if it's raining. It gets a little bit annoying after a little bit of time. And then conversely, summertime, if you don't have prescription sunglasses, it can get a little bit annoying on having to wear glasses that don't have your prescription. The quality of your vision is not as sharp, and so that's another reason. It can kind of just add up, if you will, on what you're having to spend for corrective lenses. And so this is actually a really popular time for people to have a vision correction, is right before the summertime, for that exact reason. So obviously, it's if you have ever had the unfortunate situation of falling asleep with your glasses on, we know exactly what that means. You're going to have to kind of get them replaced. And here's a perfect example. And then we kind of pivot to talk about contact lenses, and it just literally, I mentioned this earlier, it can be a little bit annoying, to have that hassle of having to get the the solution and fiddling around and putting your finger in and out of your eye. And for a lot of people who've got really dry eyes, maybe, or just a irregular astigmatism, and they find that contact lenses don't really work for them. So dryness of your eye is one, especially for patients over a period of time. That can be a large reason why they consider to kind of move forward and to stop wearing contact lenses. So here's where, and Dr. Luca, where my favorite part of the webinar comes in, which is where we get to talk about sort of questions that patients have. And so, what we have found is that some people, they could be considering LASIK. It could be several months, up to a year or two. And really what we find is that after somebody gets that opportunity to have this straightforward conversation, it really kind of condenses the period of time that it takes for them to decide if they want to have laser vision correction. And so before we go into the questions, excuse me, the last thing I'd like to mention is, again, to my point earlier, making the decision to find out if you're a candidate, the last thing we would want to do would be to find out you've spent 2 or 3 years getting yourself ready and like, all right, I'm ready to have LASIK now, and then you find out that you're not a candidate. And so I always say, if you're considering this, come in for that free consultation and see whether or not this is something that you want to pursue. So, here's the top 5 questions that patients have about laser vision correction. And so if you have, here they are right here on the screen, and we're going to go through each of these individually. And I'll kind of get the first one to you in a second, Dr. Luke. But one thing I will mention is that if you have any specific questions that you have that are not on this list, please kind of just jot them into the patient chat there. We'd love to be able to answer any and all questions. No question is too strange or too weird or too anything. We'd love to answer them all. So with that being said, Dr. Luke, let's talk about the actual procedure. And for a patient who's considering laser vision correction, how much time do they got to take off of work, and what can they expect from the moment the procedure's completed, for the first 24 to 48 hours? What's that experience like?
No, so thank you again, Michael. So let's start by talking about LASIK, which is the most common laser vision correction procedure that we recommend here at ClearSight. So the procedure itself is very straightforward. It takes about 10 to 15 minutes. Of course, you are here a little bit longer because we're very careful about all the scans and measurements that we take. But typically within 24 hours, most of your vision returns. You have to be careful to keep your eyes clean for a couple of days, but overall, most people are able to go back to most of their normal activities within a day or two. So, for example, somebody having surgery or having a procedure on Friday, we see them on Saturday morning, and typically by Monday they're back to their normal activities.
Excellent. And let's talk about once somebody's had the procedure done, a common question that we get is this a permanent procedure? Is this something that I will need to have done multiple times. What's your answer to that one?
Absolutely. So years ago, before we had the modern technology that we have now, there was a chance that LASIK could quote unquote wear off. That's not really the case anymore with modern technology. But the change that we make to your cornea is permanent. Now your eyes do have birthdays, just like the rest of your body, and we can't stop the aging process. So those who get into their 40s and 50s will may need reading glasses for things up close due to the loss of zooming ability. But there are options for that as well. So LASIK is a permanent solution for at least your distance vision, and there are other options such as monovision and other implants that can take care of your near vision too in the future if that's something you decide to do.
Excellent. And to that point, to kind of carry it on to question 3, so if I am over the age of 40, and whether I'm 45 or 50, and I'd like to know just sort of high level, what are my options for vision correction? Is it LASIK? Is it the having the inlays? So how just from a high level perspective, what do we tell patients who are over the age of 40 who are having that lack of zooming ability and their with their reading vision?
So this is a very exciting time. So in the last 3 to 5 years, there's just been an explosion in new technology for people over the age of 40. Traditionally, we've had what we call monovision LASIK, or we use laser vision correction to treat one eye for distance, one eye for near. But now we have a multitude of other technologies. We have inlays that we place in the cornea to help you with your near vision. There are lens replacements that really treat the problem at the source, which is inside the eye. And there are even other technologies that will be available in the next 5 to 10 years. It's extremely rare that we can't help somebody out with both their distance and their near vision. And although it's not always LASIK, there's typically something that we can do to make them better.
Excellent. With respect to number 4 on cost, I will go into that a little bit later on in the webinar. Let's talk on number 5. Let's talk about safety, and one that I'll want to add on to that. I'll supplement that question about safety for the procedure. Is a common one that we get is, well, what happens if I blink, and how do you kind of keep my eyes stable during the procedure? So could we talk about the safety of the procedure, and then also intraoperatively when they're having the procedure done, some of the things that we've got safety-wise for their care?
Absolutely. So statistically, LASIK is the most successful elective procedure in the world. It's more effective than any other procedure in plastic surgery, any other eye procedure. It's tried and true in many ways. Now, there are many ways that we make it even safer. We use during the procedure, we use a little device to help you keep your eye open. It's very gentle. We have the fastest eye tracker available. It actually tracks your eye 1,000 times a second, so it's nearly impossible to look in the wrong direction. We have plenty of experience in helping you relax during the procedure. We do give you some medication to relax you beforehand, and we talk you through the entire procedure. So all you have to do is essentially just relax and look straight ahead, and we have a wonderful team, an experienced team that will take care of you.
Excellent. One question that's not on here that I know that we get a lot is regarding night vision. And so, I think 10, 15 years ago with some of the earlier technology, that was one of the things that you would hear is well, does LASIK cause glare and halo and night vision issues? So with respect to today's technology, so if a patient has that question about night vision, what would we say to them with respect to how LASIK is today with night vision?
So this is one of the most exciting questions that I get, because I get to answer it in this way. So historically, when LASIK was first developed, we treated just a small part of the cornea. And now with modern technology, we treat the entire cornea. So at night, when your pupil becomes larger, if you hadn't had the entire cornea treated, they could affect some of your night vision. Now, somewhere between 30 and 50% of people have better quality of vision after LASIK than they had with their glasses or contacts. So in general, I tell people that they have a 90% chance of seeing better at night than they could with their glasses or contacts. About 10% of people are about the same. And there's no such thing as a true medical guarantee, but it's extremely unlikely to have any long-term issue. Now, what we found is that most people's glasses and contacts are not perfectly suited to their eyes. So with LASIK, as we're treating everything perfectly and precisely with the laser, we can almost always do better than what they have currently.
Excellent. And a final question that I wanted to ask you is, what are the age sort of I want to say limits or limitations of LASIK, but what's the youngest age for a person considering laser vision correction, and I would say on the high side with respect to age for laser vision correction?
Yeah, so another great question. So, everyone's eyes are unique, just like the rest of their bodies and some are unique. So, statistically, women typically mature earlier than men. It's, we can laugh about it, but it's true in the eyes as well. Women typically stabilize around the age of 17 to 18, and men stabilize around 18 to 19. So we want to make sure that you are stable, but at the end of high school, beginning of college is typically one of the best times to treat somebody with LASIK, and that's all. We've also found that statistically they heal the fastest and the best.
Excellent. So I'm going to continue on with the webinar content. Again, if anyone else has any additional questions that you would like to ask, please. I'll be monitoring the little chat window, and if your question has not been answered, I'd be more than happy to kind of pivot back and ask Dr. Luke to answer a few more for us. So here's some recent research done by the Oregon Health and Science University. It's basically stated that LASIK is safer than contact lenses, and the reality is that here's the reason why, is that as much as we'd all like to think that when we're taking our contact lenses in and out, what happens that unfortunately a lot of us is that bacteria that can be on our hands, and maybe our hands aren't as clean as they should, and over a period of time, you can find that you actually have a higher risk of getting a bacterial infection from contact lenses than you do from LASIK. And so, Dr. Luke, I'd love to hear your take on this slide, just about comparing contact lenses to the LASIK with respect to from the health risk perspective.
Absolutely, and that was a wonderful study that was done in Oregon, and it's actually one of many that have been done over the last few years. I look at these complication rates of contact lenses, and we are nowhere close with LASIK. LASIK is so much safer than any of these statistics here. It's the risk of any kind of an infection is incredibly low, and as is vision loss. So, I was a contact lens wearer before I had LASIK, and I know that there are risks with that. But since I've had LASIK, I know that my risk is much lower.
Excellent. And I actually have a couple questions here that came in from some of our attendees. Deborah, thank you so much for your question. Her question is, how long after cataract surgery can I get a consultation?
That is a wonderful question. So cataract surgery is, again, one of the most successful procedures in the world. But the lens can shift, and for whatever reason, it can cause and they can result in nearsightedness, farsightedness, or astigmatism after the procedure, even if you didn't have it before. Typically, we want you to heal for about 3 months before we talk about any laser vision correction, but almost invariably, we can make your vision better even after cataract surgery.
Excellent. And I've got another question from one of our attendees here. Would LASIK be recommended for anyone in the military? What's your thoughts about that?
That is a great question. So there are multiple forms of laser vision correction, and every arm of the military is slightly different. LASIK is a very commonly performed procedure in the military and for the military. There's also PRK, there's also SMILE, and there are a variety of other options for somebody looking into the military. But we treat many people who are looking into the military or are currently in the military with LASIK.
Excellent. And again, everybody that's asking questions, really appreciate it. We love these questions; they're all great ones. So, on the next slide, here's where I can talk just a little bit about pricing for you. So here's we kind of created this nice and nifty little graph here, and here's our prices with respect to LASIK. Our outcome is, we're not the lowest priced provider in Oklahoma, but what I think you'll find is that we have really invested in technology, and that's something that we're extremely passionate about, is being able to provide the best possible care for our patients. And so, the range of pricings there for those of you that are here on the webinar. You get the $1,000 gift certificate savings. The $37.98 is with that $1,000 off. So we have to adjust that. The $59.98, you would take that $1,000 off of that amount. And so With respect to one of the things that we're really, really passionate about here at ClearSight is we have a 20/20 where it's free guarantee. And so, if you don't achieve the, your 20/20 visual outcome, that's essentially, we really are so confident in our ability to get you there. That's why we have that guarantee for our patients. Dr. Luke, did you want to add anything about the actual 20/20 or its free guarantee?
Yeah, so so both Dr. Wilson and I, and as well as the rest of our team, are very confident in our abilities to make you see better, and that the 20/20 or its free guarantee is really just an extension of our success and our confidence in what we do. So we're very passionate about vision correction. We've had it ourselves, and we want to share that with the world and the community. And that's just a way for us to show that we love what we do, and we do believe in the outcomes.
Absolutely. And if you can kind of just you can see there over your lifetime, if just the amount of money you're going to be spending on glasses and contact lenses is pretty sizable. A question, Deborah, you have is, can you use a gift certificate with an insurance discount? What I advise is, you'll get the discount, you'll get the gift certificate, and just bring that into your consultation, and we'll kind of take a look and see, because insurance discounts can be different for everybody. For some people, it's an actual amount that's paid for by their insurance. If that is true, then of course, if your company is kind of supplementing and putting a little bit in, feel free to kind of take advantage of that, because that's coming out on their end. A lot of insurance companies, for example, VSP, you would get, it's either a set discount or 5% greater than any advertised price. So in that respect, you would get to be able to use the certificate and that additional 5%. It's kind of one or the other. It's not 15% and the certificate, but we kind of dial all that in for you. I'd recommend just kind of coming in for that consult, and we'll be able to tell you exactly what, just transparently what your options are at that point. So it's a great question. Thank you very much, Deborah. One other thing with respect to safety I'd like to touch on is, just a couple of years ago done by the FDA, where they were, talking about the, just the safety and the results of LASIK, and that 95% of the survey respondents got 20/20 or better. And so, the analogy I like to give to patients with respect to LASIK is, imagine you have a pool of water, and LASIK is like, you've got ice on top of that water. LASIK's like reshaping that ice. We're not going deep inside the eye. It's a surface procedure, and that's, one of the reasons why, patients 24 hours later are, find themselves being able to drive, and it's a very, as Dr. Luke mentioned, it's a very non-invasive procedure, and the results are quite phenomenal. This is, one we kind of put near the end. This is where I get the opportunity to be able to tell you how great we are. You can kind of read them on the screen there. One of the things that, here's the things that we're passionate about is we really have got the best technology that's available just for your procedure. And our job is to be able to come on in, bring you in to our clinic, and take, like I said, that fingerprint of your eye and find out which procedure is right for you, and provide you with that recommendation. And so we are very passionate about patient care, and really, we are truly honored to be able to help the patients that we have with their vision. And we look at this as a visual journey. We want to be to earn your trust for life of your vision. And so, whether you are in your 20s and 30s, or in your 40s or 50s, or a little bit later in either of those spectrums, I mean, really, we want to be there to kind of earn your trust. And so I really encourage patients who are considering this procedure to kind of check us out online. Here's where I get to talk about how awesome Dr. Luke is. And, one of the things, and the reason why I love doing these webinars is to kind of tell the story of the surgeon. And the thing that I think really stands out to Dr. Luke is there's a genuine, a very passionate, positive, and humble sort of way that he carries himself. And it's really all about the interacting with the patients. And the thing that I love, for example, and I'll give you his cell phone number for if you've got any concerns after your procedure, and so you need to kind of text them. I mean, that's sort of the level that we take it to. So, Dr. Luke, hopefully I made you blush, but I wanted to Could you maybe just let's talk a little bit about what got you into doing laser vision correction? Like, why did you dedicate your career to kind of treating this specialized arm of ophthalmology? I'd love for you to kind of share a little bit of your journey with the patients that are on the call here.
Yeah, but I think you did make me blush a little bit, so thank you there, Michael. This all started when I was very young. I started wearing glasses when I was about 6 years old, and it was like a typical first grader. I didn't want to wear them, and I would either sit in the back of the room and couldn't see anything, or I'd sit closer and I could squint and see the board. I kind of struggled with allergies through most of my life. I did wear contact lenses for as long as I could, but I always struggled with my vision until I had LASIK at the end of medical school. I was about to start internship and start working 30 to 36-hour shifts about every third day. I knew that glasses and contacts were just not going to work for me, at that time. And at the time, I hadn't been fully trained as I am now, and my vision since LASIK is now 2010. It's 3 lines better than 2020. I am extremely thankful and I guess grateful for the surgeon that I had, as well as the care that I received. And the more I learned about this technology, and the more that I learned about the research and participated in the research into vision correction, it's really just become my lifelong, now my life passion to provide that for as many people as I can. And my partner and I invest in only the best technology to make that happen. So it's something we're excited about every day. I wake up every morning ready to start, and the procedure is great, but the day after the procedure is even better. That's probably the best day of my week.
Excellent. So, and I can kind of brush by this. Here's some reviews of our patients. Again, I really encourage you. That's part of the journey for you to decide about which practice is right for you is to make sure you feel comfortable with them. And this is what today's been, is that opportunity for you in a relaxed environment to get all your questions answered and to kind of get to know us a little bit better and to make that decision. Yeah, do you want to go down this journey with us? And we'd be incredibly honored and grateful for that, and passionate and happy and all those kind of good things to kind of join and play that part for you in that with your vision. So here's the kind of one of the last slides. And again, if anyone has any questions, again, please feel free to kind of post them into the little chat box there, and we'll be able to kind of answer all of them for you. So the next opportunity for you is to find out if you're a candidate. And again, it's a no obligation consultation where you get that opportunity to kind of come on in and to meet us and to talk with our doctors and medical staff and really just to sort of discover the different options that are available for you. So whether you are in your 20s and 30s, or you're having the reading vision issue and you're in your 40s, I mean, we've got all those bases covered, if you will. And really the first step is to see what's going on with your vision and what are the options available for you. And we'll sit down and make sure you feel 100% comfortable after that visit and kind of decide whether or not you'd like to move forward or not. And so again, everybody that's here on the webinar, you do get a $1,000 gift certificate, which will be emailed out to you pretty shortly right after this. Dr. Luke, is there any final words you'd like to say to the prospective patients that are on the webinar right now?
Well, I'm just thankful for everybody who came here today to listen to us. LASIK has changed my life, and I think it's pretty safe to say we've changed and touched many people's lives through what we've done here. And please feel free to call us anytime. And yeah, it is true. Once you come here, I give my cell number to anyone, and feel free to call or text me anytime.
Excellent. I do have a couple of questions here. So I'll answer this one from John. Is how involved and how long does a typical consult take? It's roughly 90 minutes, John. It's gives us that chance to kind of get all the information that we need and for you to kind of have all your questions answered as well. I'm going to read one here from Stuart. Just one second. Actually, I'll give this one to you, Dr. Luke. Says, I'm 35. My optometrist says close vision deteriorates around 40 to 45, and I may need reading glasses. How long would my distance vision remain 20/20 post LASIK?
Yeah, again, great question. And I'm actually 35 as well. So That's something I think about. So the average age for starting to lose some of that zooming ability is 43. So the optometrist is absolutely correct. I agree. It's between 40 and 45. Now, your distance vision should not diminish for many, many years to come. That being said, just like you, I'll probably start needing reading glasses around the age of 43 to 45. And for my own eyes, I'll probably have one of the inlays, either the raindrop or the camera inlay, in about 8 years to maintain my near vision to the same level that I currently have. So it's just a matter of having, proceeding along my visual journey, and my eyes have birthdays too. I've gotten rid of my glasses and contacts, and I have no intention of going back.
Excellent. Fantastic questions, everybody. Again, I think that this has been very enjoyable. Wanted to one other thing I wanted to mention, just John, your question, which is how involved and how long the actual consult is. So there's no dilation at this exam, so it's not too involved with, you're able to go back to work right afterwards. It can be 75 to 90 minutes. So that's one of the main questions patients have is how are my eyes dilated? Your eyes will not be dilated at that examination. So again, truly grateful everybody for spending some time with us. I wanted to kind of end on that note, which is, again, we're just thankful for you choosing to spend some time with us here today. And Dr. Luke, before we kind of end it, any last little snippets from you?
Yeah, I wanted to just comment on the last thing you said. So even though we make the consult as easy as possible for you, we've invested in technology to actually look at your retina in the back of your eyes. So even though we're not actively dilating your eyes, we are evaluating them at the same time. So it's fully comprehensive, but it's as easy as possible for you.
Excellent. And so for those of you that are interested in being able to kind of move to the next stage, which is to see if you're a candidate and spend some time with us, we encourage you to either call us at the number there or to schedule online, and we'll email you out the certificate. It should be later on today. Again, on behalf of Dr. Luke and myself and all the ClearSight team, thank you so much for spending time with us here today, and we look forward to meeting you at our clinic, and have yourself a wonderful rest of your day. Thank you, everybody.